Hi everyone, I hope all is well. It's 7 o'clock on Thursday. Um, I'm very happy to be live today. It's been a long time. Sorry for being MIA. Just, it's been very, very busy, helping a lot of men, women have babies. So it's all good news. I decided to do this live Instagram from the Bahamas, where I am right now, because it is going to be, something related to the Bahamas, which is the stem cell ovarian rejuvenation, which I do think it's going to be the future for treatment of fertility and menopause and a lot of other things. We're going to talk more about it. Now, I just want to tell, our audience that we have a couple of things that happened, good stuff happened recently that we're offering. Due to the high inflation, everything is so expensive, as you probably are noticing, and we are trying to do a lot of financial structuring for our patients in the office in order to help our patients and patients all over the world have our novel technology to have babies. Now, 3 things we've done so far this year. One is we have signed 3 agreements with 3 companies that do financing for patients if they cannot afford it. 2, we are going to region by region in the United States to give free consultations. We're starting right now with the New England area. So if you live in New England, you can get a 20-minute free consultation with one of our doctors. And finally, we have a grant for 2023. We are offering for each month 1 free IVF cycle. So we will be giving 12 free IVF cycles in 2023 there's a grant application. Couple who, struggling financially, they make less than $60,000 as a household. We will cover all their fertility treatments. So this is one way of giving back from RFC to the community, and to because a lot of people can't afford fertility treatments. It's expensive and they don't have any insurance coverage. So these are the 3 things I'm very proud of, our team at RFC and everyone helping us to grow to the next level. Now, today I'll be talking about the adipose stem cell ovarian rejuvenation, or fat stem cell ovarian rejuvenation. Now, let's start with step by step of what stem cells are. Stem cells are cells, we have them all over our body, in the bone marrow, in the ovaries, and everywhere. Now, they're very abundant in the fat, right? So the fat stem cells, we can take them out by liposuction, or you can take them out from the bone marrow, such as bone marrow aspiration, or you can take them out from other tissues, believe it or not, such as placenta, umbilical cord, amnion, and these are called mesenchymal stem cells. So those cells have been studied in a lot of treatments and a lot of diseases, such as cardiovascular disease, neurologic disorders, fertility, spine, all kind of diseases. These have been studied. Now, the nice thing about those cells is that they are neutral cells, right? They have no function yet. This is a definition of a stem cell. Now, the nice thing about those cells is when you put them in different tissue, let's say I take a stem cell from the fat and I put it in my liver and I activate this cell, it has the potential to become a liver cell. And now I am regenerating my liver. Same thing. If I put this cell in the ovary, it has the potential to get activated and to become an ovarian cell, such as an egg or granulosa cell and other things. So this is the nice thing about the stem cells. And that's why there's more and more studies showing how stem cell could be the future treatment for all kinds of diseases, right? Not just fertility per se. So basically, it's called regenerative medicine, and we're regenerating some of the tissue that we are losing due to either aging and to do a lot of other things. Now, why we chose fat stem cells? Because number one, the fat is abundant, right? I have a lot. One, two, it's easy accessibility, right? With the tiny mini liposuction, it can be done even under local anesthesia, and patients don't have to sleep like the bone marrow, where it could be invasive, right? Number three, the adipose or fat stem cell tissue can actually, it has very good immune response when you put it inside the ovary. So it has been shown to actually promote a lot of health to the cells inside the ovary. What it means is that, for example, the egg survives better and becomes healthier quality-wise if you put those stem cells. So yes, they do produce things. Two, they can actually get activated to become new younger eggs as well. So again, the studies in menopausal women, low ovarian reserve, premature ovarian insufficiency, premature ovarian used to be called premature ovarian failure, poor egg quality, poor embryo quality, all those, there's tons of studies on, right? Now, the two most commonly studied ones are the fat or adipose stem cell and the bone marrow. As far as I know, from all my research that I've been doing over the last few years, that the fat stem cell is very, very safe. You know, it's easy, it's convenient, there's a lot of it, and patients have been followed up with no consequences to have any problem for as far as health, because people worry, what is these stem cells going to do? They're really pretty safe as far as the research so far. Now, let's talk a little bit about, you know, the process itself and how the stem cell can, you know, help women, right? So let's say, you know, you come to us, we see you, you have a consultation, you have low ovarian reserve or early menopause or premature ovarian insufficiency or poor egg quality, a lot of other things that, you know, we could, anything related to the ovary, even if you don't want to have children and you want to just resume your menstrual cycle, because menopause by itself also adds a lot of complications, right? Such as cardiovascular disease, osteoporosis, all that. So if we can reactivate the function of the ovary, we're not just focusing on, you know, fertility per se, but also, you know, focusing on delaying, quote unquote, menopause and it is comorbidities associated with it, because it can be very severe. Now, you come, we have a consultation, then things that we can offer you in addition to the PRP ovarian rejuvenation, and I'm happy to answer questions about that. The next step, you know, because PRP ovarian rejuvenation, you know, in our hands have been shown to work for 50 to 60% of patients as far as improvement of ovarian function. But some group, it doesn't work for them as well for unknown reasons, genetics and others. Those patients are good candidates for the stem cell ovarian rejuvenation. So patients will have consultation, you know, patient will have to come to the Bahamas, we'll do mini liposuction. At the same time, patients on the table will extract the stem cells from the fat, and then we put it in some of the PRP, which is part of plasma and platelets from your own blood. We add them to it, and then we go vaginally, similar to how we inject the PRP, we inject those stem cells. Now, it takes 4 weeks to 6 weeks for the stem cells to get activated or to do their function, right? Based on all the studies that we've reviewed. Now, they are good for up to 1 year. So the activity of this is pretty good, right? Because the PRP is, with our experience, is good for 3 months. The stem cell is good for 1 year. So during this 1 year, you know, 40, again, nothing is perfect, nothing's 100%, as you probably know. But of the women who did the adipose stem cell ovarian rejuvenation, approximately 40%, up to 50%, have resumed some type of menstruation. They've seen their AMH go up. They've seen their FSH go down. They've seen a lot of improvement in you know, their status in general. So that's great. If I can help, if 50% of patients who come to us will benefit from PRP, then out of the other 50 will benefit from the stem cell. That's up to 75%. That's great, right? Because we want to move the science forward. Now, you know, and I forgot to mention as to why the Bahamas, for many reasons. Number one, I like the Bahamas. Two, it's very close to the United States. It's actually, believe it or not, I find it closer than Florida because the flights are always on time and there's no delays. 2.5 hours. And three, they have a lot of expertise and a lot of centers here, that are famous all over the world with stem cell research. They're very open to the stem cell research. They have ethics committee. They monitor it very closely. So they're very active in medical tourism, and they encourage a lot of, new novel ideas to come to the island to offer it to everyone. Another thing we're hopefully planning to do is it could be hopefully we're planning to is mitochondrial replacement therapy or 3-parent baby. We can talk more about this at certain in the future, but today we're going to focus on the stem cell process. Now, so that's in summary the adipose or fat stem cell ovarian rejuvenation. Now patients we have someone who can help them with booking the flight, someone is going to pick them up from, that's why I'm here to kind of finalize and make sure everything is in shape before we start launching this process. We're planning to start in January of 2023. A lot of patients already have their name on the list, but hopefully we will we'll try to accommodate everyone. So you'll ask me who's gonna do that. I will be coming one weekend a month, and we have a little place. I'm gonna come one weekend a month, and I'll be doing the procedures myself and then going back to the United States. Now we can start taking some of the questions. Now someone's asking, how long patients do you need to be in the Bahamas for? It's really very similar to the PRP, ovarian rejuvenation. You come here, you can come and go the same day. It's a 2-hour procedure, number one. Two, it's a mini liposuction. A lot of places we could do it under local anesthesia if patients don't want to have a sleep or IV sedation. Then we prepare the PRP, and then which we usually prepare before the liposuction. Then we add the stem cell to the liposuction, the stem cell to the PRP, and then we go vaginally and inject them in the ovaries. So, all in all is really 2-hour thing from beginning to end. But of course, you're welcome to stay longer. The Bahamas is beautiful. I would recommend you come the day before, do the procedure and go the day after, or if you want to spend more time, that would be amazing. But 2-hour process is the whole thing. For that. So if there's as far as price, I honestly, my team is working on the price. I don't know that yet. We're trying to see how it's going to the whole thing cost. We're doing this because we want to offer this. We like new novel ideas. We want to push science forward. We want to give babies to those who are, don't want to go to donor egg process. I don't know. My team is still monitoring. It's seeing how much it's going to cost us and stuff like this before we launch the price. But it just should be very, very soon. If you can give us till probably end of November, we will be able to know the exact price. And I promise we will email everyone, or we will post it somewhere. Now, so I'm just looking through the questions to see if you guys have any questions. So someone is asking, I'm 46, wishing to get pregnant. The stem cell is going to help, in my opinion, people might think I'm crazy, it's going to help any woman, even at 70 years old, get pregnant. Please don't wait till you're 70. But what I'm trying to say is that as long as you are healthy to carry a baby, which in the United States, the ASRM, or the American Society for Reproductive Medicine, said up to age 55, as long as a patient is cleared by her primary care doctor that she's healthy enough to carry a pregnancy, then you should be okay. There is no age cutoff, right? So it doesn't matter if you're 46, because those cells, remember, are going to be hopefully activated to new younger eggs, right? Because the eggs that women has, they're there since she was born. So as the women get older, the eggs get older. But now we're putting new cells that are getting activated to make new eggs. So those eggs are brand fresh, if you want to call it, eggs. So this should hopefully help anyone get pregnant with their own eggs. Again, look, This is what the study showed. 40 to 50% of women did very well on the fat stem cell ovarian rejuvenation. So that's a summary. If you guys have any, I'm trying to see through, going through all these questions. Much add. If you if you would like to be added to the list, please shoot us an email. You can send us a message on Instagram and say please add me, and we can add you to the list. Can I use my nephew or niece's stem cord? So this is a great question. Great. So there is a stem, there's umbilical stem cells, as I said, placental stem cells. I want to do, what's best for my patients and what I feel comfortable with based on the science behind it, right? Right now, I'm not comfortable using cells other than the adipose stem cells, to be honest with you. It doesn't mean things might not change in the future because, we're monitoring the data that's published on PubMed. We're monitoring all the studies. We're talking to colleagues. We monitor their work. One of my colleagues, Dr. Ayman Al-Hindi, that I have great respect for, is and University of Chicago is one of the pioneers who looked at bone marrow stem cell in mice and rats, and those what they did is they gave them chemotherapy for the mice. They put them in menopause, and then they put bone marrow stem cell, and a lot of those mice resumed ovarian function and ovulation. So that they did great things. They showed they're safe in mice. There is one clinical trial that showed it's safe in humans as well, and that's what encouraged us at RFC, because we're always craving for new things to push a little bit the field forward and to make it happen, because I think it's time to make it happen. Is it approved in the USA? It's not approved or disapproved as far as I know. Some stem cell therapies are approved in the United States for certain diseases, but the FDA has not approved, as far as I know, any stem cell treatments for ovarian function. I think they have other priorities, in my opinion. Maybe they'll come up soon with it, but they haven't really approved the stem cell therapy or mitochondrial replacement therapy, which, by the way, the last one is approved in the UK for mitochondrial disease and approved here in the Bahamas and in Ukraine, as far as I know. But so that's another reason why we chose the Bahamas, because we're waiting for the FDA to give us the green light to perform it in the United States. So until then, we want to do things, legally and following the regulations of the United States. So what's the percentage of it working for POI patients? So great question. Most of the studies that looked at POI, hard to compare animals to humans, but there are studies on both. 4 divided by 9, close to 50% of women who had POI responded at some point by having menstrual cycles after the stem cell ovarian, the adipose stem cell. So to answer your question, if I have to give a number, it's between 40 and 50% of women with POI will respond to that. So we're going through the questions. It lasts, someone's asking how long it lasts. As I mentioned earlier, it lasts, based on the research that I've done, up to 1 year. The effect is there. So look, maybe those studies did not follow those patients for a longer period of time, because a lot of time with studies is very hard. You lose patients as the time goes by. So it doesn't mean it's not good for afterwards. But as far as I know, patients that were followed for 1 year did very well on this. When do you get the stem cells? I keep some. Someone is asking, well, if you're too skinny, then I don't know what to get fat. I'll give you some cookies or whatever. So, eat. I don't know. I wish I can give you some. I have a lot, but no, it has to be your own. We can't use someone else's fat stem cells. Now, should the procedure be done more than once? I don't know the answer, right? Like people ask me about PRP, should I do once every month? I don't know the answer either, because until studies compare one time versus a couple times, it's very hard for me to counsel patients, because we are very evidence-based medicine, and we believe the science and what backs up the science. So as far as I know, it's good for 1 year. So if you want to do it after 1 year, they'll probably say 1 year or so, you can do another one. Now, maybe a study comes up tomorrow that shows if you do it more than once, it's better, then I'll change my mind. But as of now, one every year is enough. Looking here. Who will conduct the procedure when you're not there? I'll be the only one doing the procedure. I'll be planning to come 1 weekend a month to do the procedures here. So yeah. Is the procedure safe for people with PCOS? Now, great questions. Now, and who's a good candidate? The good candidates, and I put it on our new website that we're launching really soon, is if you have low ovarian reserve, low AMH, high FSH, premature ovarian insufficiency, if you have chemotherapy-induced ovarian failure, I'm reading it now on my laptop, if you have poor egg quality, if you have poor embryo quality, if you have early menopause, which is menopause in early 40s, and if you have menopausal symptoms such as hot flashes and you're not a good candidate for hormone replacement therapy, or you don't want to take hormone replacement therapy. Now, is it safe for a woman with PCOS? I don't see why it shouldn't be safe. I'm not aware of a lot of studies, honestly, that looked into this for women with PCOS. I don't see a reason why a woman with PCOS would need that, because she has enough eggs. They have actually a lot of eggs. Now, I can tell you, studies on women with PCOS showed that even though they have a lot of eggs, they tend to have poorer egg quality, because women with PCOS, they have a chronic low body inflammation. And when you do PRP, right, we actually have a paper that Dr. Marco and I were submitting. When you do PRP in women with PCOS who don't have a regular cycle, you actually can regulate their cycle, because now you're putting a lot of growth factors that the eggs love, and they tend to have to ovulate on their own. Now, whether the egg quality is going to be better or not, it remains to be determined. But there is another well-designed study on women with PCOS where they injected PRP, and also they resumed ovarian function and the hormonal profile in those animals. But for stem cell, I don't see why you really need it if you have PCOS, because there is a lot of other things that's, available right now. Looking for other questions. Why do this over PRP in your office? Well, as I mentioned earlier, PRP is great. It's promising. It's fast, and we've had a lot of women and couple and men who had babies with PRP. Science behind, there's over 100 papers published in medical articles about PRP and ovarian function. Now, unfortunately, like anything else, it doesn't work 100%. So those patients who did PRP and didn't work for them, in my opinion, are great candidate for the adipose stem cell ovarian rejuvenation. I hope I answered your question. Will this help ovarian failure due to chemotherapy? The answer is yes. And actually, believe it or not, most studies that they were performed in animal model, they gave them chemotherapy to put them in menopause. Then they did adipose stem cell or bone marrow stem cell, and they showed improvement. So yes, as far as I know, it does work for them. And that's why in our website, chemotherapy-induced ovarian failure is one of the indication to do adipose stem cell ovarian rejuvenation. All right, looking at this. So in those studies, along with resuming menstruation, was there an increase in follicle count? The answer is yes. Those studies looked at ovarian volume, and in women who have early menopause or low number of eggs, the ovaries usually shrink. So the ovary became larger in volume. The granulosa cells, or the cells that are around the eggs, they were much more in number and density. 3, there were higher number of follicles inside those ovaries. 4, the AMH went up significantly, and the FSH went down. all this indicates that not just the hormonal profile is better, including estrogen that went up, but also the structure of, and that's the nice thing about the fat stem cells. They change the structure of the ovary. By the way, this is, I just remember this couple of studies that when those adipose stem cells, they induce the ovary to make new blood vessels, right? So it's called angiogenesis. So it's basically, it's like giving life to a new tissue, right? So that also have been studies. It affects the immune system of the ovary itself as well. So to answer your question, yes, it has shown to increase the follicle counts. So I did talk about, someone's asking between stem cell and PRP. Now the PRP is not stem cells. Let's go back about. The stem cells are stem cells we're taking from the fat and putting it. The PRP is only platelets and plasma that we take from your own blood. And when we inject them inside your ovaries, it works through 3 mechanisms. One, it wakes up some of the dormant eggs that women have. And we know for a fact, women who are postmenopausal have approximately 1,000 eggs left inside their ovaries. The PRP wakes them up. 2, it improves the quality of those eggs. I can spend an hour to tell you how, but in summary, your PRP has human growth factors, HGH. Some people use Omnitrope, a lot of clinics. That is crucial for the egg development and egg quality. So even women who have a lot of eggs, but they have poor egg quality, PRP could help them. And 3, remember I said earlier on, we have stem cells all over our body. Well, guess what? The ovaries have stem cells too. They're called ovarian stem cells. Those, when you put the PRP, these ovarian stem cells can get activated and become new, younger eggs, like I said before. So now the adipose stem cell is adding to the PRP. I'm planning to put both at the same time here. You're basically increasing the pool of stem cell inside the ovary and activating them. And by the way, you know what has stem cells? The period of a woman, the menstrual cycle. If you get the period, you'll get endometrial stem cells. And these stem cells have been injected in the ovaries, right? And have been shown to improve outcome. So these stem cells have been also injected in women who have Asherman syndrome, who have thin lining, who have failed and has shown to improve the lining of the uterus. So yes, the period of a woman when it comes out, some of the lining that comes out have also stem cells. That's the easiest way to actually get stem cells, believe it or not. But it's a little bit more cumbersome, not studied a lot. And that's why I said, I think, our focus now on stem cell, I think is going to help a lot of women, get pregnant and carry babies and uterus and all that stuff. A lot of people are studying stem cell on fibroids. This is not part of my expertise by any means, but just to kind of let you guys know. Now, let me go back to the question. I hope I answered your question. Let's go back. AMH, a good number for unknown. They need IVF. Oh, that's a great question. Someone is asking if I did ovarian adipose stem cell, do I need to do IVF? No, you don't. And most actually the studies that they did ovarian stem, they conceived naturally, not IVF. That's the nice thing about it. You're getting new. Now, if your tubes are blocked, then you need IVF. If the sperm is poor, then you need IVF, right? Because but if everything else is fine and the problem is just the egg, you can get pregnant naturally. You can have sex at home and get pregnant, or IUIs, donor sperm, or whatever it is. No, you don't need. This is a great question. Okay. All right. What is the guarantee to have at age 52? Look, 52, if you're healthy. Look, I have a patient who's 57 years old, right? Well, she didn't get pregnant with her own eggs. She did donor egg, but give me. Okay. So sorry about that. So what I was gonna say is 57-year-old, right? So she, as I said earlier, 55 is the cutoff according to the ASRM, but they didn't say don't do it for someone older. 57, She is healthier than me, okay? I sent her to every single test. I promise you, her cholesterol is better than mine, blood pressure better than mine, stress test better than mine. She delivered healthy baby, and she's amazing. And she came to my office a couple of weeks ago to check on. So it's the problem with the age is as we get older, we're more likely to have diabetes, hypertension, cardiovascular disease. They're correlated. But it doesn't mean you have to have them. You can have someone who's 25-year-old, morbidly obese, smoker on drugs. I'm not going to get them pregnant. So, I think we need to go case by case. I hate to put cut off for age or for BMI or weight. I really do, because if we keep those cut off, how are we going to move the field forward? And nowadays we do things like, they say, oh, your BMI is high, you can do IVF. Why? Because they're scared to put that person under IV sedation for egg retrieval, but we do it under local anesthesia. So the risk is gone. Anybody who's morbidly obese can have sex at home and get pregnant. We don't tell them don't do that, don't get pregnant, but we have to put rules on IVF. I respectfully disagree. And as far as age, I hate to put age. A lot of places put age because, again, it's good for statistics and pregnancy rates. The older you are, the more excited I get, because the oldest person we've had in our office is 50-year-old. We have a couple of them, actually. One of them delivered a healthy baby using her own eggs. But, as long as you're healthy to carry a pregnancy, I'm happy, or we're happy to help you. I hope I answered your question. Look in here. If you didn't respond to PRP, would that mean you wouldn't respond to stem cell treatment? No, really not. They're not related to each other, right? They work through two different mechanisms. Well, they work together, but not independently. I think you should start with PRP. It's easier. We do it in the United States. If it works, great, we celebrate. You can drink because you're pregnant. But if it doesn't, unfortunately, then we need to talk about the next step, which is the adipose stem cell ovarian rejuvenation. In menopause, after treatment, can I have any eggs? The answer is yes. It is done for women with menopause, because you do have eggs that are dormant. We can wake up, and the stem cell that we put there could potentially become new younger eggs. And exposure to COVID after PRP, I'm not aware of any any relationship between COVID and fertility per se. Now, I know the COVID and the vaccine themselves, like any immune response, can, even if you have a cold or a flu, your period is going to be irregular for a couple of months and sometimes comes back. But I'm not aware of any long-term effect about that. Do you have any similar procedure for sperm quality? No, I don't. Honestly, what we can offer men who have low sperm is ozone sauna. If you are local, we have one in Long Island, Westchester, and Connecticut. And we've shown, actually, Dr. Hadi Ramadan, was our fellow now, he's at Harvard finishing his training. We just submitted an abstract that showed that semen improve after 6 sessions of ozone, quantity, quality, motility, and even some morphology. The sample size is small, but yes, it makes sense because ozone is a very powerful anti-inflammatory agent, and inflammation is everything. Aging is inflammation. Everything is inflammation. Everything. So lowering body inflammation makes sense. We have another, paper looked at endometriosis and ozone, and we show the pain scale of women with endometriosis and even their immune profile in the blood, such as CRP, interleukins, and TNF-alpha dropped significantly after 6 sessions of ozone. So, but as far as stem cell and sperm, I'm not aware of the literature. It's not my specialty. I'm sure there are studies, but it's not my expertise. What is chromosome abnormalities? Please explain. So if you're meaning by chromosome abnormalities in the embryos, it's different than chromosomal abnormalities in you. Now, people, a lot of time I talk to a couple and I say, do you want to do PGT or pre-implantation genetic testing on your embryos? They were like, no, we did genetic testing on me and my husband and they're fine. The genetic testing you do on you and your husband is testing for single diseases like cystic fibrosis. It's not testing for Down syndrome and other syndromes. Remember, Down syndrome babies come from normal parents. They don't come from Down syndrome parents. So, in summary, a man is 46 chromosome, a woman is 46 chromosome. We need an embryo that's 46 chromosome. So the egg and the sperm have to split equally to 23, right? Then sperm 23, egg 23, they need to give 46 chromosome baby. Now, this splitting that happens in the eggs and the ovaries and testicles does a lot of mistakes. So instead of cutting equally the apple into 23, you're cutting into 24, 22. If this is 24 and this is 23, you put them together, now 47, that's Down syndrome. So even though you're genetically, and the splitting, unequal splitting increases as women get older, right? And PRP have been shown to help with that. Again, happy to go through the mechanism, but I probably need an hour. It has been shown to increase 5 times the chances of having chromosomally normal embryo. I'm talking about the PRP, before and after. If please let me know if I did not explain it properly. I'm happy to explain more about the chromosomal abnormalities as well. So how to thicken the uterine lining? You know, it's a different subject, but there is a lot of things that we do. Number one, our expertise is hysteroscopy. First, look inside the uterus to make sure the room is empty. There's no spider webs in the corners. Cut them. Spider webs or scars that don't have blood flow. 2, we have a lot of protocols. If you have immune issues, we have immune protocol which involve intralipids, PRP infusion in the uterus, and other things such as prednisone, baby aspirin. Now, Viagra vaginally works very nicely as well. You'll be like, what the hell are you talking about? No, I'm not crazy. The Viagra works for men by increasing blood flow to the penis. It causes erection. Same thing. Women put Viagra vaginally every day during the embryo transfer cycle. It increases blood flow to the lining of the uterus and thicken. Vitamin E, pentoxifylline, which is used for carotid clotting, and so GCSF, which is like a Neupogen, we do infusion inside the uterus. There's a lot of things that can be done. And now PRP, if there's no lining, it can still go. You go by camera with the hysteroscopy and inject PRP in the lining of the uterus. It regenerates some of those cells. Remember the stem cells we talked about that comes with a period? Those can actually get activated and build a new lining. So it's a lot to talk about. Stem cells are the future. People are using them for multiple sclerosis, Lyme, cancer, and having amazing results. That's true. Thank you for your comment. It's political, but I think this is an amazing step forward for women to have babies. I agree with you, but I'm not going to talk about politics. But thank you for the comment. I appreciate it. And I think you're welcome. We talked about the chromosomal. It's not fully, if the clinic is fully open, it's not fully open yet. I hope you enjoy the Bahamas. I'm actually here till Saturday, so shoot me a message if you're here. Happy to meet you. And endometriosis. Can the effect for POI patient last more than 1 year with Eastern? I don't know the answer as of today. Most studies followed patients to up to 1 year in women with premature ovarian insufficiency, and they showed improvement. It could, but we will be following our patients longer to see how things go. How will you know that the stem cell worked? Yeah, great question too. What we're going to do, we're going to monitor every patient very closely. The stem cell ovarian rejuvenation takes 4 to 6 weeks to kick in, right? And then it's good for up to 1 year. During this time, we're going to monitor you every week to 2 weeks or 10 days to see how your blood levels and hormones and number of follicles by ultrasound are getting better. If they're getting better and you're starting to ovulate on your own and you're in menopause, guess what? You can get pregnant on your own, have sex at home if you have a partner. You're welcome. The recovery procedure is really minimal. As it's a mini liposuction, very small incision. And the injection in the ovaries, like PRP, 50% of our patients, they do PRP in the ovaries under local anesthesia. 50% they like to sleep. I like to sleep. It's beautiful sleep. But it's really fast procedure, and the recovery is really very, very minimal. Okay, I'm looking here. You're welcome. Now the PRP, when will you see results? I always tell patients it takes at least 2 weeks to start kicking in, right? But after 2 weeks, it doesn't mean if it doesn't work, it's not gonna work. It takes up to 8 weeks in certain situations. And the PRP is good for 3 months. Even though some studies showed it's good for 6 months, I promise you, and I've been doing this for a long time, and I started this on the East Coast, it's good for 3 months. Women in menopause, I do PRP. They ovulate 3 months, and then the effect is gone. So I would do one every 3 months if I were you. Is stem cells safe for endometriosis patients? You have to be careful with endometriosis patients. Endometriosis patients are tissues that grow, and so if someone doesn't know what they're doing and they're putting stem cells or PRP in the endometriosis, is not a good thing. So the answer is I would avoid it, because physiologically speaking, it might make the endometriosis become worse. So probably not a great idea. Okay, well, thank you everybody. I think we're gonna end the session on adipose stem cell ovarian rejuvenation. I'm very, very excited that we're starting this in the Bahamas, January 2023. I will be doing more topics and more live Instagrams from now on, I promise, as much as I have time. And I'm looking forward to helping you guys and moving the science forward and having babies. So enjoy your evening, and thank you so much for joining. Have a great day.